I went into nursing to make an impact on people's lives. Especially right now, I think it's relevant with making impacts on different people's lives and growing by experience. COVID-19 has shaken me to the core. It has helped me grow not only as a person, but as a nurse by experience. All of the patients that I've had recently have helped me immensely to grow bigger than I ever thought I would. Recently, I had this patient, and not all outcomes are good, and some can be bad, especially now. But I recently had this patient who changed my life forever, and it's not a situation that I will ever forget. What turned out to be a normal shift in the beginning of the day turned into one of the hardest shifts of my life. I sat in with this patient for at least 6 of my 8 hours. Limiting exposure was not an option for this patient. She just kept screaming that she wanted help. She was searching for air that she couldn't get, and she was just overall struggling. When I left that night, I had that sinking feeling in my gut. When I came in the next morning, of course, my worst fears were realized. She was still screaming, still searching for air to breathe, asking for help from anybody who was nearby. It took her family a really long time to make a decision. Even though she was a DNR, DNI, the patient's family didn't know if they wanted to pursue other options. But after a long mourning, the family finally made her a CMO. And the patient, although those 12 hours were probably agony for her, she got to pass peacefully with staff by her side. She got to talk to all of her family members one last time, and to watch her pass peacefully, no longer searching for air to breathe. That is what I'll remember forever, sitting there comforting her in her last moments and telling her that it was okay and that we were all there for her. Make me feel at peace. And although right now it's extremely hard to see what each outcome can bring, I'm a nurse and I want to cure everybody and I want to treat everybody. But unfortunately, especially right now, that's not an option, but I still strive for it.